coordinator of the bariatric program. I help patients to meet their insurance requirements as well as the program requirements for surgery, but also I make sure that they're educated and really know what they're getting into through the bariatric surgery process. I'm actually a bariatric surgery patient myself. I went through this program 7 years ago and had a gastric bypass, so that's kind of my main interest, but I've also worked in surgery and then worked with the surgeons on a personal, as their nurse in their office. So I've worked with patients in the preoperative stages as well as after surgery. I feel like that really gives me a great way to kind of get that personal relationship with people. I can actually really tell them, I've been there. I understand what you're going through. I know it's not fun all the time, but you know the results can be amazing. I think the part that I enjoy the most is actually seeing people meet their goals. And everybody's goal is different. I think some people, it's more of a fitness goal, and then there's other people who just want to be able to reduce the amount of medications that they're on. And so being able to see them do that is really amazing. I really think that the biggest thing that sets us apart is our one-on-one approach with patients. We make sure to sit down with them in our visits and make sure that they really understand what they're getting into, understand the diet progression after surgery, and to know that we're here for them, before to answer their questions, but as well as after. In the long term, we'll help them get through all this. Seeing patients really meet their goals, all these things that they've been working so hard for, maybe haven't succeeded in the past, but then they have the surgery. They're changing their lives with all these new lifestyle habits, ways of eating, ways of staying physically active, and I think that seeing them get to the point where they're really improving their quality of life, it's really rewarding for all of us. I went through this program 7 years ago. I've been where you're at. I understand, all of this very well, and it can be life-changing. I've become more active. I was on blood pressure medications. I'm no longer on blood pressure medications. I'm got just a whole new lifestyle with better eating habits, better exercise habits, and I'm there for my family, and I think that's the most important.